Hello, good morning.
Good morning, doctor.
Thank you. I am Dr. Bishas, doctor of this clinic. May I confirm your name and age, please?
Yes, doctor. I'm Van Diesel, 25 years.
Okay, nice to meet you, sir. How can I address you?
You can call me Diesel.
Okay, Mr. Diesel. I came to know that you have a history of changes in your vision. Is it right?
Oh, yes, doctor. Yes.
So, is it okay if I discuss about this condition with you?
Yes, please, doctor. I want to know.
During our discussion, I may take some notes, but all the information during my discussion will be remain confidential. So, is that okay?
Okay, doctor.
So, can you please tell me that what has happened to you?
Oh, doctor. For the last actually 6 months, doctor, I think that I have been facing some problem with my vision. Okay. Previously, I was quite all right, but nowadays I think that I bump into objects quite regularly, doctor. Okay. So that's really troubling me because I am a student and I have to go to my classes by using bus. Okay, but nowadays as I bump, even one day I had a small accident as well. So that's really bothering me, doctor.
I'm sorry to hear that. Can you tell me more about that? You said that it started 6 months back. Did it start gradually or it started suddenly?
Yes, doctor. It started quite gradually, doctor. I cannot just remember uh, what happened. But in the first days, I didn't give too much attention to it, doctor. But now it's really taking a toll on my daily life.
Okay, that is. And can you tell me that where do you bump? Bump by the side or bump on the head?
Oh, doctor, I think I bump on the sides, doctor.
Okay. Have you ever bumped into the head?
No, doctor, I think that I see quite well in that head direction, doctor.
And do you think that it is increasing gradually or remain the same?
Yes, doctor, I think it's increasing day by day, doctor.
And do you have any dimness in the vision or any haziness in the vision?
I cannot specify, doctor.
And can you tell me that do you have any pain in your eyes?
No,
Any changes in the eyes, like any redness or any yellowish,
no, doctor.
any drooping of the eyelids?
No,
Have you ever seen double?
no, doctor. I don't think so.
Okay. Have you ever suddenly lost total vision that you cannot see anything?
No, doctor, that didn't happen to me.
Do you have any problem with the color discrimination?
Yes, doctor. Sometimes I have some problem with main color discrimination. That doctor, that's another issue. That's I have to face while while handling traffic in the roads.
And is it problem with the right red light or green light?
Yes, I'm telling you that the traffic problem.
Okay. And do you think that your problem increases at night or in the dim light or same?
Oh yeah, that's another issue, doctor. That's another issue. I have severe problem while going out in the night.
Okay. And do you think that your problem has any specific timing of the day when it is more like in the daytime or
Yes,
night time?
doctor, I think
One thing says that
it could be
it's
that at night.
more at the night time. Okay. Have you
Yeah.
ever noticed anything that make your condition worse or better?
No, doctor, I couldn't remember of any.
And before the onset of the symptom, did you get any injury to the head?
No, doctor, no.
Can you tell me that how much this condition is affecting your daily life?
Very much, doctor. Very much. Actually, I am since my childhood, I have not been a very good student. Okay, so I've been in college after quite trouble in my life. So, but now again this problem with my vision. So I'm just devastated, doctor.
I'm sorry for that. I'll try my level best to uh, do something for you. And I'm going to ask you a few general questions. Do you have
Okay.
any headache?
Headache?
Yes.
No, doctor.
Okay. How about your mood?
It's more or less okay, doctor.
Have you noticed any changes in your hearing?
No,
Any rash anywhere in your body?
no,
Any skin change, any skin lumps, bumps?
no, doctor.
Okay, how about your appetite?
Quite good. But doctor, although it's quite good, I'm quite obese, doctor. That's a huge problem in my life.
Was from the childhood or recently?
I think it's quite from when I was 10 years old.
And may I know about your food habit?
No, doctor, it's quite okay, doctor.
Do you take regular foods on any specific foods?
I take doctor regular type of foods, doctor. Nothing very specific about it.
Okay, and recently you have gained weight or lost weight? Have you? Can you mention anything?
Doctor, I think I have gained weight, doctor.
And can you tell me that have you noticed any changes in the weather preferences, like any hot preferences or cold weather preferences?
No, doctor.
Do you have any chest pain?
No,
Any racing or pacing of your heart?
no,
Any shortness of breath?
no, doctor.
Any cough?
No,
Any tummy pain?
no.
How about your bowel habit?
This is quite good.
And your water what?
Quite good.
Any weakness at any side of your body?
No,
Any joint pain?
no joint pain, doctor.
Have you noticed any changes in your skin ever?
No, it's quite all right.
And may I know that do you have any past medical condition?
No, doctor, not that I know.
Any history of diarrhea recently?
No,
Any bug infection in the chest?
no, doctor, no.
And may I know that do you take any regular medication?
No, doctor, I don't take any regular medication.
Any over-the-counter medication?
No,
Any herbal products?
no,
And do you have any allergy to any medication?
no.
Any of your family members have any problem with their vision?
Oh yes, doctor. My sibling, my younger brother, he also have that this type, almost similar type of problems, doctor. He's only 14, but I can already notice that he has got quite obese, like me. So I think he's facing the same problems.
And did he seek any medical attention?
No, doctor.
And any of your family in your family member have any type of history of sudden death in your family?
No, doctor.
Any problem with heart?
No, doctor. No,
And is it okay if I ask you a few personal questions?
not at all. Please go ahead.
Do you smoke cigarette?
No,
Do you drink alcohol?
no.
Do you have any hobbies or any leisure activities?
No, doctor.
And may I know that do you drive?
Yeah, I used to, doctor, but recently I have been facing some problems due to my eyesight problem.
Okay, that is good until we are sure that what is happening with you, stop driving.
Okay.
Do you think that you need any social support or any economical support?
No, doctor. Nothing specific. I just want to get well, doctor.
Okay. As I have taken your history, I need to examine you.
Okay.
So I got to examine the hand for any rheumatological condition or any skin changes, any pigmentation.
No skin changes. That in hand you will find polydactyly, 6 fingers.
Okay. And after that, I want to see the pulse.
Okay.
Okay. After that, I want to see the eyes for visual field.
Visual field is it's a tunneling of vision, very much restricted temporal field of vision.
Okay. After that, I will assess the visual acuity.
It's okay, but color vision is affected.
And then I will go for the eye movement.
Okay.
Pupil
I think the vision is restricted, so the eye movement is also there is some problem.
and then pupil.
Pupil is okay.
Okay. And after that, I will go for, I want to like do the fundoscopy to see if there is any
Yeah, bone pupil
fish
pattern
bone.
appearance.
Okay. And after that, I want to see the hearing and if there is any problem.
Hearing okay.
Okay. And after that, I want to listen the heart.
Heart okay.
Normal. Okay. Then I want to palpate the kidney.
Okay.
And then I like to elicit the zarks.
That's all right.
Okay. And plantar is flexor.
Okay. So I think the time is over.
No. 2 minutes.
Almost left.
Uh,
Okay. So
yes.
okay.
Okay. And after that, I will go for the I want to do the urine deficit test and capillary blood glucose level measurement.
Okay.
May I know that what is
It's
the
quite
concern?
obvious. Okay, doctor, what is going on? Is it a family issue, doctor? I just want to know now. I'm getting worried.
Yeah, actually, as I have taken your test and I examined you, I think you have a condition in the eyes. This is called retinitis pigmentosa. Have you ever heard of it?
No, I have no idea at all, doctor.
Okay. And actually, in this condition, there are some deposits on the eyes, and especially on the distant side of the eyes. So there is vision is affected, so that you are having this type of problem. And
Okay.
this is actually a progressing condition that it will progress further, but I will have to do some other test to find out uh, the other associated conditions, and after that I will have to involve a group of doctors so that they will combinedly help you in your condition. We will involve the eye doctors. I will involve some specialty doctor. We call it that hormone doctors, and they will combinedly able to help you to treat you in this case.
Okay. Okay, doctor.
Do you have any other question for me?
Doctor, does it run in families, doctor? What do you think?
Actually, as I have taken a history, it seems that it runs in the family.
Okay. Okay, doctor.
Time up.
Okay, so what do you think your diagnosis is in this patient?
For the gentleman, my diagnosis is this is the retinitis pigmentosa, and there are several causes for retinitis pigmentosa. I cannot totally be sure that what has happened, what could be the exact diagnosis.
Okay. Okay.
Name some
But there are
mitochondrial
three or
condition.
four. Okay, there are 3 or 4 conditions very much
Yes,
associated with
there are
retinitis. Okay.
there are that is for retinitis pigmentosa. There are conditions like Usher syndrome and some
Okay.
mitochondrial abnormalities. I actually
Okay.
forgot that.
Okay. Let me tell you. Okay. There are some conditions. One you excluded very well. That was Kearns-Sayre syndrome by
Yes,
asking
that syndrome.
hearing problem, heart block. Okay. It's the mitochondrial myopathy and sometimes diplopia as well. But whenever you find this any hearing problem, I think you should also exclude others like Usher's refsums. Okay, if there is any hearing problem, Usher's disease, refsums, and Cairns side. Okay, there are some other conditions as well. Don't forget these two: abital hypoproteinemia. Okay.
Beta lipoproteinemia. Okay.
Yes, when there is abital hypoproteinemia, there are some specific symptoms. Okay, there can be cerebral ataxia, so there can be loss of balance, peripheral neuropathy, and steatodia. Okay,
Okay.
any difficulty flash away, and also difficulty in maintaining gait or balance, and any abnormal sensation or pain or something like that. Okay, and another which I actually told many points, that is the that case I have seen actually. Lawrence Moon Bardet Biddle syndrome. Okay, obesity, polydactyly, learning disability, and also subfertility or hypogonadism.
Okay,
Okay.
Lawrence Moon-Bridle syndrome, actually, they are more uh, less intellectual, I think.
Yeah, he is also quite less intellectual. He's now 25. He's just going to college, which means class 11. So,
Okay.
so I think in perspective, I think he's quite less intelligent. Abital hyperproteinemia and Lawrence Moon Bardet Biddle syndrome. These two are associated with learning disabilities, and obesity, polydactyly, and also very important. The patient I have seen in my life, he also has the same problem with hypogonadism or subfertility. He has got small penis. Okay, obese, polydactyl, and schooling has not been that much good. And sometimes these patients can also develop diabetes. That's where the problem arises. If the patient had, if I had told you that I have diabetes, then it would have been important to ask about diabetic retinopathy, any involvement with the eye doctors previously, and any laser treatment, because the most important DD of retinitis pigmentosa is laser photocoagulation. Okay. Okay.
Okay.
Almost same type of eye findings in fundoscopy, blackish spots in both retinitis pigmentosa and laser photocoagulation. And other DDs, what can you think of other DDs in this patient? Apart from retinitis pigmentosa, what are the causes of gradual loss of vision?
Okay, that can be vitamin A deficiency. Then
Okay.
this can be case of in retinal hemorrhage,
Yeah.
retinal detachment.
Okay. Have you asked flashes about flashes and floaters?
No.
I think you should have asked that.
Then cataract,
Okay.
diplopia,
Glaucoma,
glaucoma.
cataract, glaucoma, retinal detachment, retinal hemorrhage, diabetic or hypertensive retinopathy, and also laser photocoagulation. I think these are most important. Okay.
Okay.
Okay. So how would you like to investigate these patients?
Okay. In investigation of this gentleman, I will go for the routine investigations like complete blood count to see anemia and white blood cell count levels, then inflammatory markers, after that liver function test, renal function test, and after that serum lactic acid level, and with that you will go for the mitochondrial that I will go for the genetic study for any mitochondrial condition, and after that I will go for the some imaging test, that is pan-retinal imaging,
Okay. Okay.
uh,
Retinal photography, I think.
retinal
Pan retinal photography.
pan-retinal
Okay.
photography, and after that
And genetic testing.
ECG, echocardiogram, and hearing assessment,
Okay.
audiometry.
Okay. 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 So how would you like to manage electroretinogram?
I don't have any idea about that.
Yeah. I think you can also do it. Okay, that's all right. So how would you like to manage this patient?
Management is actually multidisciplinary approach. First, educate and counseling the patient, then involvement of the uh, ophthalmologist, involvement of the endocrinologist, then involvement of the genetic specialist, involvement of the physiotherapist, and involvement of the specialist nurse, and involvement of the GP.
Okay. 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 I think it's a progressive condition. In this condition, I think visual aid can be important. Okay. Okay. So anything more would you like to tell me?
No, I have no idea, much idea about these conditions.
That's all right. That's all right. I think here not much could be done. The genetic counseling and supportive treatment like visual aids and just forming master reducing routine
Is,
and
is it a
involving.
mitochondrial condition? Mitochondrial disease?
No, no, no. It's not a mitochondrial condition. I think it's an autosomal dominant condition, as far as I can remember. Okay.
Autosomal dominant.
I'm not sure. I have to look again. I'm not sure at this moment.
Okay.
Okay. Okay. So is that all right now?
Okay.